Hello and good morning to everyone here on the West Coast, and good afternoon to those of you logging in from time zones east of here. Welcome to today's event, the Easiest Online Forum. So today we're thrilled to let you know that we have about 100 people registered, and we know many of you are viewing in a group setting. So thank you so much for joining us today. My name is Greg Lockwood, and I'm a research associate at the Social Research and Demonstration Corporation, also known as SRDC. I'm also one of the project team members with the Easiest Project. So what is Easiest? Well, to start, Easiest stands for Easier Access to Settlement, Integration, Employment, and Skills Training. It's a 3-year project funded by Immigration, Refugees, and Citizenship Canada through its Service Delivery Improvement Stream. I'm going to leave the exciting details of what Easiest is all about for my colleagues to describe later on in the forum. For those of you who are not familiar with SRDC, a quick word about our organization. SRDC is a nonprofit social policy research and evaluation organization with offices here in Vancouver, as well as Ottawa, Calgary, and Montreal. SRDC's mission is to help policymakers and practitioners identify policies and programs that improve the well-being of all Canadians, with a special concern for the effects on the disadvantaged, and to raise the standards of evidence that are used in assessing these policies. If you're interested in learning more, we welcome you to visit srdc.org. I'm going to ask our guest speakers to turn on their webcam so we can just do a quick hello. We're here in 3 different locations, Victoria here in Vancouver, and then New York City. So you'll hear more from our guest speakers later on. And I'm just gonna pan over to Barbara and Susanna. There's Barbara and Susanna, hello.
Good morning.
Getting back to today's online forum. So along with telling you more about Easiest, we are thrilled to showcase 3 different initiatives that have aims of improving programs and services. And we are delighted to be joined by guest speakers from, who you see here on your screen, from MDRC in New York and the service design team in the BC Public Service, to learn more about the work they have done in the service design and behavioral insights areas. We are also keen to tell you about the BizHub project and some of its lessons for program improvements. So along with seeing the faces of today's presenters, you should now be able to view the agenda on your screen in just a second here. So there's today's program. The forum today has a duration of 2 hours, and we intend to leave 15 minutes at the end for questions and discussion. We really encourage you to submit your questions and comments to our presenters in the questions feature of your panel, which many of you have already used in the first few minutes here. And let us know who the question is directed to, if it's one of the speakers or to everyone. We also have a couple of audience polls lined up to receive and share your input. So I think we're gonna shut down the webcam and get back to the slides and the first poll. Final note here to let you know that the forum is being recorded. So if you cannot stay for the duration, know that you will receive a link to the recording in a follow-up email, and we will also be sending out the slide decks. So now let's get to the first poll. Here we just want to get a sense of folks that are joining us today. So the question, hopefully you can see, I see people are selecting their responses, what sectors are represented today, and we're just going to give you about a minute for you to select the answer that best applies to you. And while we do that, I'm going to introduce our first speaker. So you can see on the screen here, this is Susanna, and she's my colleague at SRDC, also my boss. And she's Research Director and Chief Privacy Officer here, and has managed and conducted social policy research and evaluation for over 30 years. Her research and program experience with social and health issues spans many areas, including employment, education, income security, and immigration. She holds an MA in Economics, a Bachelor of Science in Mathematics, and is a Canadian Evaluation Society credentialed evaluator. So let's take a look at the poll results. I'm going to close it. Most of you have had a chance to answer. So I'm not sure if you're able to see it on your screen. I'll try to do that right now, but you can see that 56% of you are in the employment services sector. 13% in government, 7% research or academia, 18% in settlement services, and 5% clicked other. So hopefully, it sounds like we captured most of the sectors broadly with these categories. So a nice mix of folks joining us today. So as I mentioned, Susanna is going to kick things off by taking a few minutes to tell you more about what Easiest is. And it's now my pleasure to hand the mic over to Susanna.
Thank you, Greg. I'm really excited that you're joining us today for this forum. We have a lineup of innovative initiatives that I know the presenters are keen to share with you. These initiatives involve user-centric design methods and behavioral insights to make improvements to programs and services. If you don't know what this means yet, don't worry. You're going to be learning more about it in the forum. To repeat what Greg has said earlier, Easiest, easier access to settlement, integration, employment, and skills training. The premise behind Easiest is settlement and employment service providers are always looking for ways to improve and to provide high-quality client services more efficiently. Making changes, though, to complex day-to-day operations and processes is not easy. So how does Easiest help? Easiest is a new, exciting, innovative project funded by the Immigration, Refugees, and Citizenship Canada. Easiest brings together immigrant serving organizations in British Columbia to work in collaboration to address these challenges by developing innovative, low-cost solutions that make their services as easy to access as possible. It also presents an opportunity to raise the profile of behavioral insights in the settlement sector. Ultimately, the goal is to improve newcomers' outcomes and settlement experiences by helping service providers deliver the most appropriate services at the right time and for the right duration. This project is relevant and timely as Canada prepares to receive more immigrants in each of the next 3 years. So how will Easiest achieve this? You'll hear more about the approach later on, but briefly, Easiest will work with a group of service providers to identify bottlenecks or aspects of services that could be improved. This is kind of a unique feature in that a lot of this often is done with a single organization. We're doing this with a group. We will work collaboratively with the group to identify and develop improvements that are evidence-based. We will test the improvements and establish what does or does not work using random control trials where possible. We are focused on evidence-based changes. Easiest was built on the Work and Biz Hub, a project that you'll hear more about later. We have adopted and adapted this framework for Easiest, which is illustrated in this diagram. It's a framework to support systematic, creative, and collaborative problem solving that focuses on, first in the pink box, process improvements. And we've also integrated aspects from behavioral insights and design thinking into the framework. Again, you'll hear more about this later. So just a teaser for you to stay for the 2 hours. Now, to kick off the presentations, it's my pleasure to introduce the next presenter and session, Nudging Changes in Human Services, the Behavioral Interventions to Advance Self-Sufficiency, or the BIAS Project. Xavier Alemany joins us from New York today, where he works at the Center for Applied Behavioral Science, or CAPS, in his role as design analyst. At CAPS, he leads the graphic design and development of behaviorally informed intervention materials for MDRC's behavioral projects. Over the last 2 years, he has worked to design and test behavioral solutions on several projects at MDRC. He has worked one-on-one to help programs incorporate insights from behavioral science to strengthen their service delivery as part of a technical assistant engagement. He holds a BA in psychology and a BBA in business management from the University of North Florida. So hello and welcome, Xavier. I'm going to let you take it over now.
Hi, everyone. Thanks so much for that introduction, Susanna. I appreciate it. So hey, everyone. My name is Xavier Alemany. As Susanna mentioned, I'm a design analyst for a social policy organization in New York City called MDRC. And first, I want to thank Susanna and Greg for inviting me to speak with you all today. I think Easiest is a really exciting project, and I hope that hearing about MDRC's experience implementing a user-centered and behavioral science intervention is really interesting and useful for all of you in attendance. So today I'm going to talk to you all about a study that MDRC did called the Bias Project. But first, I'm just going to give a little bit of background about my organization. So MDRC is a nonprofit research organization that specializes in measuring the effects of social and educational programs and policies. So normally we do this using randomized control trial evaluations, but we also use a host of other research methods. And we also help programs and agencies through our technical assistance work. And we work in a few domains or broad content area buckets like K through 12 and higher education, families with children, and low-wage workers and communities. So within MDRC, I'm a part of a group called the Center for Applied Behavioral Science, or CABS. So CABS exclusively focuses on using behavioral science to make programs more effective. And I'll define behavioral science in a bit more detail in a couple of slides, but basically we use insights from this field to design solutions that address some challenges that social programs face, like low participation rates and inefficiency. And typically the solutions that we design are pretty low cost, and we also make sure to measure and evaluate how well those solutions work. So what are we going to talk about over the next 25 minutes or so? So first, I want to define behavioral science for you. So what is behavioral science, and why is there a whole center within MDRC that focuses on it? Next, I'll give you an overview of the Behavioral Interventions to Advance Self-Sufficiency, or BIAS project. And I'll tell you about what inspired the project, the goals of BIAS, and generally about the outcomes we were working to improve. After that, I'll talk about the problem-solving process that we use for BIAS, which is called Behavioral Diagnosis and Design. Next, I'll give you an example from BIAS of generally how we worked with an agency, the challenge that the agency faced, and the solution that our behavioral design process led us to. We'll quickly just touch on the findings and takeaways from BIAS, and then finally, I'll mention a few resources that you could all look up for some more information and to get more details about each of the studies within the project. Great, so let's jump in. What exactly is behavioral science? So the simplest definition of behavioral science is that it's the study of how humans behave in the real world. So it's a field of social science that draws on insights from academic fields like psychology and economics. And importantly, the field teaches us that decision-making is not purely rational. Over the years, we really find that a good way to help define behavioral science is by mentioning the central tenet of the behavioral approach. And that is to always prioritize the user's perspective when trying to understand and improve outcomes. When we're designing a program or policy or anything that another person is going to use, we always need to look at that end product from the perspective of the person who will use it. Okay, so I'm sure that this makes intuitive sense to most of us, but who are our users? So there are kind of two broad views on human behavior. The first view says that humans first receive some information, and then at that moment, they understand and absorb everything they've been presented with. And then they go ahead and do a very sophisticated and precise cost-benefit analysis, taking into consideration every short and long-term consequence of each choice they could possibly make. And finally, they conclude and execute the optimal choice for their well-being. I know, like if you weren't all on mute, you'd be agreeing vehemently with me that you all do this for every decision that you make in your life. No, we know that this is very much unrealistic, but it's actually on this fictitious kind of rational agent that most economic models of decision making are based. Okay, so here's a more realistic view of human behavior. So we're presented with some information. And then there are a ton of factors that influence whether we understand the information and influence whether we understand or what we do. So for example, are there other people around? How many decisions have you made today? Are you under stress? Did you make a choice or did you do nothing? And then how much time did you have to decide? And then taking into account all of those contextual factors and many more, you may make some choice, maybe. And then you act on that choice, maybe, right? So this perspective on human behavior, which applies psychology to explain decision making, is a bit more in line with how we make decisions and behave in real life. And this is what behavioral science is really all about, right? It's understanding a realistic framework for human behavior and using that as the guiding principle for how we design programs and policies rather than that fictitious rational agent model that we talked about. So let's go ahead and talk about the BIAS project. Before we jump into what we did in BIAS, I want to quickly tell you about 4 insights from behavioral science that really motivated MDRC to pursue this work. So the first is something that we've talked about. We need to understand any process from the user's perspective if we want it to be effective. The second is that actions, really, they don't always reflect our intentions. So we might want to do something, but end up doing something else for a huge variety of reasons. Like we might have every intention of going to the gym, but things quote unquote come up, right? The third behavioral insight is that small changes can have relatively large effects on outcomes. Changing 1 or 2 small things like removing a barrier or making something automatic can have an effect that's disproportional to the size of the change that you make. And then finally, we need to identify the problem before we create a solution. So this sounds kind of obvious, but when most of us think about a problem, we normally have some embedded assumption about what's causing it. And that immediately points us in the direction of specific kinds of solutions. We don't want to do this. We really need to understand the problem first before we make any assumptions about what's causing it. Okay, so BIAS stands for the Behavioral Interventions to Advance Self-Sufficiency Project. The project was funded by the Office of Planning, Research, and Evaluation, which lives within the Department of Health and Human Services of the United States federal government. And it ran from 2010 to 2015. And it did a few things. So firstly, BIAS applied behavioral principles to large-scale human service programs. It investigated problems using this behavioral diagnosis and design problem-solving methodology that I mentioned already. And it developed quick and inexpensive changes that focused on immediate outcomes. Here's the BIAS project portfolio, and it includes a total of 15 tests within 7 states in 3 domains. So in the work support domain, the interventions we developed improved engagement in appointments and activities in 2 different states. In the child support domain, the interventions we developed helped to improve child support payment rates in 1 state and increased requests for child support order modifications in 2 states. And I'll be talking more about one of those studies that we did. And then finally, in the child care domain, our interventions increased the number of child support subsidies that were renewed and increased parents' use of high quality rated child support providers. And it's important to note, I'm just showing you kind of this portfolio because we found positive results across all 3 domains. So this adds to the body of evidence that insights from behavioral science can really be applied across a variety of contexts. So what's this behavioral diagnosis and design process that I keep mentioning? This process is really kind of the bread and butter of the behavioral approach and of everything we did in BIAS and our other behavioral projects here at MDRC. It's a 4-step problem-solving approach, and it's actually similar in a lot of ways to the approach that the Easiest project will be using. So first, the process begins with define. In this phase, we define the problem while making sure not to make any assumptions about what's causing it. So for instance, let's say the problem is that many program participants are not taking up an important service. So we should be careful not to state this problem like, how can our program make clients realize that the service is important? Because this phrasing, as you can hear, kind of assumes that the reason participants aren't taking up the service is because they don't think it's important. Now, this might be the case, but it's an assumption. So once we investigate further, we might see that participants do think the service is important, but there are some other reason or collection of reasons why take-up rates might be a little bit low. The second step is diagnose. So in this phase, we investigate the context around the problem to figure out why it's happening. And there's a few things we do in this phase. So we gather both quantitative and qualitative data to get a better understanding of what's going on. And this includes looking at administrative data that an agency might have on hand. This includes interviewing everyone involved in a process, which it includes participants and staff at all different levels. And we'll also look at documents like forms, policies, websites, etc. In diagnose, we also create a detailed process map, which is basically just a map of the participant's journey through any given process. Finally, we also hypothesize what behavioral barriers are causing the problem. And for that, we rely on the body of behavioral science research that exists. The third step is design. So in this phase, we design an intervention that uses insights from behavioral science or behavioral insights to address the challenge that our agency partner is facing. And we do this by linking behavioral solutions with the barriers we identified in that diagnosis phase. The fourth step in the process is test. And during this phase, we evaluate the solution that we developed in the design phase. And most often, we'll conduct this evaluation using a randomized control trial so that we understand how outcomes differ when people receive the intervention versus when they don't. And I just want to mention that this is ideally an iterative process. So sometimes you'll test a solution that worked in some ways but didn't work in others. So you revisit the diagnosis or design phase and then improve on your original solution. Okay, let's get into a concrete example from bias. I'm going to talk a little bit about the study that the bias team did in the state of Texas. So the Texas study focused on an issue that affected incarcerated non-custodial parents. So if a non-custodial parent is incarcerated, but they owe child support, of course they have a limited means to make their child support payments. And these parents can actually be faced with a lot of debt once they're released. And actually, one study that we found projected that the average incarcerated non-custodial parent in the United States would leave prison with an additional $20,000 in unpaid child support. And that obviously poses a serious barrier to reentry into society and regular employment after they're released. But in the state of Texas, there's a process for parents to apply for a modification of their child support order so they can leave jail or prison with less child support debt. But even though this process exists, the diagnosis that we did found that only 31% of parents who were eligible for a modification even applied. And even though the Texas Office of the Attorney General, or OAG, sent them an application, only 31% were actually following through and applying. So the bias team worked with the Texas OAG to address this challenge using insights from behavioral science. And the problem statement was framed like this: how might Texas increase the number of incarcerated non-custodial parents who apply for a child support modification? And as you notice, the problem statement is framed neutrally, so it's not assuming any cause of that problem that they're facing. Okay, let's talk about what the bias team did. So during the diagnosis phase, we worked with the OAG to map out the application process and then to identify bottlenecks or barriers to see where changes to either the process or the materials that they were using could lead to an increase in the number of submitted applications. Once the diagnosis phase was completed and the team had gathered, a substantial amount of information about the problem, they redesigned the existing outreach materials that the agency sent to parents, and then they also added a couple of new materials. So the first thing we did was to include a teaser postcard. And the point of this postcard was to expose the incarcerated parents to this process of modifying their child support order. And I just want to mention that this addition wasn't just arbitrary, just we're trying to get additional materials out there. The underlying idea was actually, since diagnosis uncovered that because parents who received this order modification packet were not familiar with what they were receiving, they were just more likely to ignore it completely. So exposing the idea to them ahead of time was meant to combat directly that challenge. The team also redesigned the introductory letter and application packet using simpler and more direct language. And we also personalized them. So not only by adding the parent's name, but by pre-populating information wherever the state had information on file. So this made the application process a lot easier for parents. And finally, the team sent a follow-up reminder postcard to remind parents to take action. So reminders are especially effective when a person intends to do something, but for whatever reason, never had the chance to follow through on that intention. So as for the findings, we saw that these changes to the outreach materials basically increased the percentage of parents that submitted completed applications by 11 percentage points. So in the research world, this is considered a statistically significant increase. And it's 11 percentage points, but it's actually about a 40% increase from the original 27.7%. Okay, so the last thing I want to talk about are the overall findings and the takeaways from the project. So like I mentioned, we tested each of our behavioral solutions in bias using randomized control trials. And those tests allowed us to understand how the interventions impacted each outcome of interest. So I'm just going to do a quick breakdown of the findings from each test. So like I said, there were 15 randomized control trials in total, and each site saw a significant impact on at least one primary outcome of interest. Effect sizes typically range from 2 to 4 percentage points, with some impacts that were larger, like the Texas study that I mentioned. And here, if you look at this chart, the x-axis is the impact size in percentage points, and then the y-axis is the number of tests that had similar impact sizes. And then this just basically allows you to see the range of impacts for all 15 of the tests that we did. And I just want to mention that although 2 to 4 percentage points might not sound like a lot, most of the time these interventions were very inexpensive. As you can see in this chart here, the intervention costs were typically less than $4 per program group member. And just a quick statistics note, many of the tests had pretty large percentage change, right? So a lot of tests began with low take-up rates or attendance rates. So a 4% percentage point increase is actually a pretty substantial percentage change. So just to summarize, while impacts were typically modest, the bias team found that these results were A, consistently achieved, B, very low cost, and C, they were scalable, which means that they could be applied for a large number of participants. And finally, here are some of the operational achievements from bias. So the participating agencies each launched the interventions while meeting their ongoing program deadlines and mandates. So this is important because it wasn't too heavy a level of effort where they needed to hire additional staff or forego anything else that they were doing. The behavioral approach was really embraced by leadership at each agency. As we worked with them, the value was really evident and even beyond the tangible results and outcomes that it presented. And the interventions were all implemented with fidelity. So we were able to help each agency execute the interventions as we designed them. Okay, and finally, I just want to leave you with a couple of resources where you can find out more information. So the title of this presentation, Nudging Change in Human Services, that's the title of the final report of the BIAS project. So this report includes a description of what we tackled at each agency and the intervention we designed for in each test. And you can find that, you can Google it, or you can visit our website, mdrc.org/cabs. We're also active on Twitter, where we tweet about our latest work and general news in the behavioral science world. And you can contact us directly at cabs@mdrc.org. I'm one of the people who receives the emails that go to that email box, so you can contact me there as well. And yeah, so thank you all for your time. I really appreciate it, and I will pass it back over to Greg.
Thanks so much, Xavier. Really great way to share what you've done at MDRC in terms of behavioral science and putting into practice. We did have one question come in during your presentation, so I think because we're ahead of schedule, I'll just share that with you now. So we have someone who's asking about the costs. So when you had that chart showing the cost of the different interventions, very inexpensive, almost all of them under $5. What went into the calculation of those costs? Are you able to just kind of share sort of a brief overview of what that cost amount actually incorporates in terms of the intervention?
Yeah, it's a great question. So typically for the intervention costs, these are going to be whatever materials that the agencies had to purchase that they wouldn't have otherwise. It could include the cost of sending text messages. It might be 10 cents per text message, or it could be the cost of new types of materials. Like for instance, in some of the interventions, we used blue heavier paper because we believe that people would be more likely to open a piece of mail that was on blue paper or something like that, right? So it's just the materials cost typically is reflected in that cost per person. And yeah, like as you mentioned, it was generally $4 or less.
Excellent. So that's all of the questions that we have had come into this point related to your session, Xavier. So we do encourage folks, if anything kind of percolates over the next little while, please send those along, and we'll save those for the panel at the end. So I'm just going to switch it back to our slides here at SRDC. So just give me a second here. So I think I forgot to show your photo there, Xavier. So there you go for folks that get an idea of your role and your image there. So we've got next presenting is Deanna Young and Sim Schachter. They're both with the government of BC. I'm going to see if I can launch our next poll. Okay, so I'm having trouble finding the polling feature, so we'll try to get to the poll after this presentation. So hopefully folks can see the screen showing Deanna and Sim. And so I'm just going to introduce Deanna and Sim. So Deanna Young has spent 28 years in the BC Public Service, asking how government can build better services for citizens. As the former Ministry Web Manager and User Experience Lead for the Ministry of Education, and now as the Service Design Manager for the Government Digital Experience Division, GDX, Deanna always puts the citizen first. She works with ministries to help them understand their users and develop the tools and services they need. Sim has worked with leading design studios, technology services, strategic communications, and innovation consultants in Singapore, Japan, India, and Canada. And in her practice spanning 11 years, she has handled comprehensive visual and systems design, ethnographic research, workshop facilitation, and product development for clients in the private and public sectors. So currently she works as a service design specialist applying her insights and knowledge about the human-centered design approach to building innovative solutions for citizen-centered service delivery. So I'm just going to now pass the screen over to Gianna and Sin, and you should be able to see their slides on your screen now. So again, you can see here the presentation is service design in the BC Public Service, and I'm going to pass it over to you, Deanna and Sin.
Great, thank you, Greg. Welcome everyone, and thank you for having Sim and I here today with you. Today we're going to talk about service design in the BC Public Service. We will talk about what service design is. We'll talk a bit about the service design approach within the public service, and we'll provide some examples of our project work. But before we do that, we quickly just want to introduce you, if I can advance the slide, there we go. I just quickly want to introduce you to our team here in the BC Public Service. So this is us. Our team consists of about 10 people. We reside in the Government Digital Experience Division, otherwise known as GDX. We are in the Government Communications and Public Engagement area, otherwise known as GCPE, or Giuseppe, as others like to lovingly call us. The team started out as the User Experience Design team in 2011, and since that time, our practice has evolved. And in 2013, we actually started doing service design. So you may be asking yourself, what is this service design? Well, service design is the activity of planning and organizing people, infrastructure, communication, and material components of a service. And we do that in order to improve its quality and the interaction between service provider and its customers. When we talk about service design, you may be thinking about the web channel, you might be thinking about the phone channel, maybe frontline counter services, other technology or policy maybe. Service design will look at the holistic service experience across all of these touch points. Often, this can cross many silos. So in the private sector, there is a practice. It was first introduced as a design discipline in the early 90s. And in about 2004, the Global Service Design Network was launched to create an international network for service design academics and professionals. And today, what we have seen is there are service design study programs, bachelor's and master's degrees at post-secondary institutions globally. So why service design? Well, service design and the methods of design are ways of solving problems that are especially helpful for creating improved service experiences by focusing on user needs. Service design assists with taking complexity and creating meaningful order in our work. What we're finding in our research over the past several years is that British Columbians are really having a hard time with our services. They've told us that information is hard to find or can be really overwhelming. Time is an issue. People are busy. Phone and in-person channels have limited hours, so access becomes an issue for people. Forms are the door, or sometimes the closed door to government, and it's sometimes the only interaction that people have with our government services. They want to know what their service status is, where they are in the process, and overall, there really is a lack of service awareness. So we find that people don't just come to us to hang out with government. They come to us when they need something from us, or we actually tell them to do something for us. People are already in a high emotional state or crisis, so our services really need to be easy. So really we use design thinking to help create better experiences for people. We take complexity and create meaningful order. And through the service design process, we break down silos across the BC Public Service. So here, we have found that there are many organizations that have created process maps or models to develop a shared language within their teams. What you see here is a design thinking process model. It's an approach based on the UK Design Council. It's known as the double diamond principle, so you may have heard of this. The process is divided into 4 distinct phases: discover, define, develop, and deliver. This double diamond is a simple visual map of the overall design process. This cycle expands our research and design, and then we narrow down or target our focus as we move through definition and development. And really, what you see here, this is what it feels like when beginning a design project. Things are really going to feel messy, especially at the beginning, and really that's okay. You really want to let the process emerge on its own, and eventually we find it will. And although our team has been doing this for many years now, for most in the BC Public Service, this is really a new way of working. We're working to understand the whole wicked problem, we narrow down on the worst pain points, and then we tackle those. So I'm going to turn it over to Sim to give you just a little sense of what the global context looks like in service design right now.
Thank you, Deanna. There are many companies nowadays, both in the public and private sector, who've begun to use service design and design thinking to improve services for their customers, citizens, and their staff. As you can see on this slide, there are other government agencies such as Government of UK and Australian government also using service design to inform policy development, with the Government of BC up there amongst many of these organizations. I know our talk is called Closer to Home. However, before we get into the local and BC government context, we'd like to take a bit of a detour and provide some global context to show you that we are not alone here in British Columbia Public Service doing this kind of work. We have rounded up 3 case studies to share this global service design context in the public and private sector. First up, we have a case study from the city of New York. The New York City mayor implemented a program called Homestat in late 2016 to serve homeless New Yorkers, but quickly discovered that homeless individuals found the program confusing and did not take full advantage of its offerings. To understand why the adoption and engagement from the user group might be lacking, they decided to use principles of service design. They incorporated field research to directly engage both homeless individuals and frontline staff. As an output of the service design research with the homeless people and staff, the service design team created a journey map that tracked the experiences of homeless clients through city systems and made policy recommendations around program and performance management, like the number of caseworkers, location of homeless outreach services, and eligibility thresholds. This case study is an example of how service design approach can contribute not merely to service implementation and adoption, but also help provide guidance to government on formulating policies based on citizen needs. Private sector has its own take on incorporating service design. For example, Airbnb is putting its own spin on the service design practice by sprinkling designers throughout departments. The company has added a member to each project team whose sole purpose is to represent the user. But this team member isn't a designer. It's that project manager or developer role in the organization that is championing and being the voice of the user. Airbnb hopes that this will address the issue of product teams creating solutions only they will love. The user-focused perspective is also meant to add conflict to discussions and ultimately lead to a more nuanced experience for their customers. Finally, more closer to home, service design also plays a role in not only improving customer experience, but also frontline staff experience. For example, Telus wanted to validate the viability of a newly designed tablet-optimized customer dashboard. Basically, an app for a tablet which will be used by their sales staff in store. This dashboard was developed by the product team for the frontline staff to enhance the in-store user experience. For this project, the service design team was tasked with testing out this dashboard application along with the Telus product team. A co-design workshop was conceptualized with each table having participants consisting of in-store frontline staff, one member from the Telus product team that designed the application, and a Telus customer. The workshop included developing a journey map from the perspective of staff and customers. Additionally, for the product team to get an understanding of day-to-day in-store customer-staff interaction, a role-playing exercise was conducted with scenarios of when a customer walks into a Telus store and their experience during the interaction to create the next iteration of the customer dashboard. However, as an outcome of the workshop, the biggest finding was not around the dashboard, rather around the customer frontline staff relationship. Through the role-playing of scenarios, it was realized that customers felt that frontline staff using the tablet while interacting with them made the staff look evasive through their body language and the lack of eye contact due to their focus on the tablet, hence causing a sense of mistrust. From a frontline staff standpoint, interacting with customers while having a heavy tablet all the time in their hand tired them and overwhelmed them while catering to customer needs. This led the product team to explore ways of putting staff-customer relationships at the center of the experience. So by taking a service design approach, Telus helped bridge the gap between the digital and physical world. All these case studies show you how user-centered design can lead to better outcomes and viable solutions. And now, finally, as promised, we'll share how we are actually doing this locally in BC and in public service. To start off, we are in BC Government's 2016 corporate plan where ideas work under Goal 3. And as outlined in that plan, it states that in government, we need to adapt the service design playbook and other citizen-centered service design principles and practices consistently in the development and delivery of public service by using innovative approaches to problem solving like behavioral insights and service design. The service design playbook mentioned in the corporate plan is a comprehensive guide to service design process developed by our team. And just like a service design process, we have tested it and validated it, and now it is in beta form. You can download a copy at gov.bc.ca/service-design. What we have in front of us is the service design process, a model that has been documented in the service design playbook and provides comprehensive methods and tools to enable people in British Columbia's public service to design better services for British Columbians. This model is divided into 6 phases, and depending on the scope of a project, this model evolves to fit the project requirements. Our research and design activities follow this model, so let's take a quick overview of the phases within it. In alignment, we start with asking ourselves if we are ready. We then move them to discovery, where we take an evidence-based approach to understanding the current state of where the service is at today. In the opportunity phase, from the research evidence in the discovery phase, we develop the right ideas for tomorrow. In prototype and test, we analyze and evaluate on how those ideas could work. In roadmap, we develop an outline of how do we achieve our goals. Finally, in implement, we work towards how to make those ideas real and tangible. Deanna will now share some case studies of how we have incorporated these phases into the work.
Great, thanks, Sim. So under alignment, before we undertake significant work, we will make sure the project addresses a real problem for citizens, setting expectations, developing partnerships and teams, really understanding the business problem. This phase can take several weeks and sometimes up to a year to get in alignment. It is so important that program areas are ready to work with us. When we began working with Ministry of Health in 2016, we assembled a team consisting of executive members from the BC Government's Ministry of Health and our own GDX division. We did that to find ways of improving online service delivery for MSP, which is BC's Medical Services Plan. We also looked at premium assistance as well, and we put a focus on service awareness, enrollment, and communication. So as seen in this photo, the executive team here worked alongside us to ensure we were in alignment with the right business problem to solve. In discovery is about understanding the current state. We do a lot of research as well as build capacity with program area staff. Working closely with the Ministry of Agriculture, we looked at nutrient management planning tool to better understand what users and key stakeholders needed from such a tool. The project team talked with farmers on Vancouver Island and in the Fraser Valley in a variety of sectors, such as dairy, fruits, vegetables, and others. And we did that to gain insights into the needs and behaviors that would increase adoption and value of nutrient management tools and education materials. Opportunities are informed by the research. We explore what things we can do to achieve service improvements or inform new future services. Working with the Ministry of Mental Health and Addictions, the project's team spent many weeks out in the field talking with people who use drugs alone indoors, as well as friends, family members, and service providers who provide them with support and guidance. The team held many workshops with key stakeholders from across the province, and in this example, you'll see through a co-design workshop, we worked with people with lived experience. The team spent time having participants develop opportunities for public messaging, their ideal healthcare experience, a safe place, a safe space to use safely, as well as technology ideas that may help them. The team took all the ideas and developed an opportunities booklet for the ministry, and it consisted of about 44 opportunities. I'll turn it over to Sim to talk about the other phases.
Thanks, Deanna. During prototype and testing phase, it involves making ideas that were developed during the opportunities phase tangible so that they can be understood, tested, refined, and improved. In this phase, we test multiple solutions and concepts with actual users and citizens and iterate on the design based on the findings from the testing sessions. This helps manage any surprises and mitigates risks before launching the services for public consumption and hence increasing their value. These prototypes are developed and tested across multiple touch points and could be digital like a web application or physical like a front counter service experience. The example we have up on the screen is from when our team worked with Emergency Management BC within the Ministry of Transportation on their public alerting project. Based on the key findings from the research, we looked at the future state opportunities and identified several to test. One of the prototypes the team tested was what it would look like if people were to receive an alert on their mobile device in the event of a natural disaster. As you can see here, the team used paper prototypes and our own homemade cardboard mobile device to test earthquake tsunami messaging with citizens. And those of you joining us from BC got a sneak peek of the final outcome yesterday when you might have received an emergency alert test message on your phone. The roadmap phase is when we get into mapping the path ahead by communicating clear strategies to realize opportunities and follow a vision for the future of the service delivery and address ways to continuously improve our services. Roadmapping helps us establish shared understanding, priorities, and plans through communication and visualization about the future of the service delivery. As an example, when we were working with the First Peoples Cultural Council on the First Voices project, we were looking at how language can be preserved and made accessible. The team developed a roadmap which outlined short-term, medium-term, and long-term tasks that included everything from user experience for the language revitalization platform to policy and governance. Finally, the implement phase is about making things real, where prototypes and iterations come to life and become useful services for people that fits within their needs and improves their experience while interacting with government. We work alongside our program areas and ministries to set them up for success through continuous service improvement. Working here with the Ministry of Health on digitizing enrollment forms for medical services plan and premium assistance, we uncovered in our alignment phase that the error rate for paper forms was at 40%. Through multiple agile sprints, our team worked closely with developers to ensure that the user research from earlier phases of the project were guiding the development of the minimum viable product, as you can see here. In the end, we implemented better tailored and guided information which helped to reduce effort and reassure citizens, as well as streamline administrative processes for staff which helped to simplify procedures. And bringing a 40% error rate down to 1% isn't so bad either, right? Although these phases we just took you through may seem very linear and structured, but in reality, the process and the approach is not so linear as we move from complexity to clarity. Within our process, we usually move between discovery, opportunity, prototype, and testing in an iterative loop to continuously improve the service. Through all the case studies, processes, and phases we took you through, what should stand out to you is that whether you are building a product, service, or an experience, it is important to ensure that you are putting its users first. Service design is about building services with the people who will be using them, rather than building services behind closed doors and hoping that they will work for your user base. To ensure that we are taking a service design approach, we follow some design principles to help guide us in our work. These design principles are like guidelines, considerations, or simply a checklist of the best practices we should be following to deliver and develop future-proof services. First and foremost, we want to understand where they are at. Talk with them, understand challenges by observing them in their natural surroundings. To do that, we go where people are, to their homes, offices, parks, or healthcare institutions, rather than expect them to come to us. Instead of having design done to people, we want to co-design with people. So developing ideas and opportunities with people who are going to consume these services. This helps not only to create buy-in with service improvements, but also brings people along for the journey, which can help build trust and stronger relationships.
So when building prototypes, we want to put them in front of people early to test them before investing a whole lot of time, effort, resources, and in some cases, significant costs. After testing, we want to bring back what we learned and iterate on design, making further refined improvements. Testing prototypes can be as easy as this example. It's lo-fi, low cost, with low effort. Starting simple helps us to identify key insights into where the biggest service improvements can be made before making any large investments or development commitments in the technology. And change is hard. Thinking holistically, changing only one aspect might not fix the problem, or it actually might cause new problems. And it isn't until we start digging behind the scenes that we can uncover deeper, more systemic issues. Change really is hard. It is challenging. It is messy, but it is also a lot of fun. So thank you for having us today, and we hope you enjoyed our presentation.
Well, Deanna and Sin, I can't speak for everyone out there, but we certainly did hear, and we want to thank you again for being part of the panel today and for your presentation. I particularly like the example of the changes you made to the MSP process. I think that's something that a lot of us can relate to. And I have to say, I would like to do another plug for your service design playbook. It's an excellent resource that I think we all have copies in our offices here. So certainly something that I would recommend folks to check out and take a closer look at.
That's amazing. Thank you. Thank you.
We're doing really well with time, and so I think what we'll do is Haley and I here have managed to refine the poll function on our panel. So we're going to take this opportunity to do the next couple of polls. So we're going to ask you to think about what you heard from both Xavier and Deanna and Sin, with Xavier regarding behavioral insights, and then of course a human-centered design focus that Deanna and Sin shared. And the first question is about BI. We want you to rewind to when you woke up this morning, and then so it's not a test on your knowledge about how much you know now, but thinking back to this morning, what would you say is your level of familiarity with behavioral insights techniques? So I suspect that this may be something that you possibly do a version of in your practice, or it could be something that you've heard about and you've read about, but even if you didn't know the terminology, based on what you know now, is this something that you were familiar with in your work previous to hearing and to hearing following Xavier's presentation? So we'll give you a few more seconds to fill that out. And I'll do my best to, I apologize for last time leaving the poll hanging there for a couple of moments. So I'll make sure to close it. So we've got, most folks are saying, we're up to about 57% are saying they have a medium level of familiarity, with about 29% of folks saying low and then 14% saying high. I think I'll close that and share it. So you can see the final results of those that answered. And I'm going to hide that, and we're going to go right into the next poll. So it's the same type of question, but it's asking about human-centered design. So what is your level of familiarity with human-centered design, whether or not you use this terminology again in your practice or in your work? So I'll give you 10 or so more seconds to select your answer. Going once, twice, 3 times. Okay. Final results are it's a little bit more on the lower side, so 7% say hi, and then 55% are medium familiarity level, and then 38% low. So most folks feeling that they're in the medium range for both BI and human-centered design, but a good range. So just to give a sense of of how you use these methods and these tools in your work already. We're going to end the polls there, and so I'm going to hide that poll, and hopefully we can get back to our own screen a little bit more smoothly this time. And so there's a photo of Barbara and myself, and I think that both Xavier and Deanna and Sim's presentations thread really nicely into the final initiative that we would like to tell you about today, which is BizHub. So in BizHub, Susanna, Barbara, and I worked with 30 practitioners from over 20 organizations to support the design, implementation, and testing of process improvements within their employment services settings. So I'm just going to switch over to our slides here. So we're going to share with you the details of their innovations and some of the lessons and program improvements we all learned. Before Barbara kicks off our presentation, I'll take a minute to properly introduce her. Dr. Barbara Dobson is a principal researcher at Goodson Consulting and has worked on a range of program evaluations, including designing, implementing, and reporting on local and national evaluation studies within the social policy and public health arenas for over 20 years. And prior to joining Goodson Consulting, Barbara was a principal research consultant here at SRDC, as well as previous to that, a research fellow at the Center for Research in Social Policy in Loughborough University, United Kingdom. So I'm going to just on our side here pass the mouse over to Barbara. Take it away.
Can I go back one? Right click?
Yeah, right click in previous.
Hold on.
We have a couple of screens going here, so we're it's a little bit more complicated on our side here. There we go.
Okay. So thanks very much, Greg. We've heard about some really exciting innovations in public services already. And what I'm going to do, as Greg suggested, is I'm going to introduce the BizHub project, and then I'll hand over to Greg, who'll tell you more about some of the work we did here in British Columbia. So BizHub was a 3-year project that began in February in 2016. So it will be completed in February next year. It was designed as a research and innovation project and was funded by the Ministry of Social Development and Poverty Reduction. So BizHub brought together BC employment service providers in small groups to address specific business processes. The small groups, or sub-hubs as we call them, work together to identify and develop strategies to improve specific processes. We had an advisory committee which helped us identify the business processes to focus on. A further objective of BizHub was to increase the awareness of the approaches that organizations could use to bring about business process improvements, and in this way raise their capacity to address other issues. I'd also like just to say that the response to BizHub from employment service organizations has been extremely positive, and we'd like to thank all our participants. I mean, Greg said there were about 30. We'd like to thank them and their respective organizations for making the project such a success. Okay, so what was BizHub? BizHub was and is a really exciting innovation project. The aim was that it would provide a framework, for systematic and creative and collaborative problem solving. So it wasn't just us as researchers coming in with a preconceived agenda, but rather the focus was on collaboration and on drawing on the expertise of our participants. The goal, as you can see from the diagram, was to place the client at the center of the process and then to work collaboratively to identify the issues and then to use evidence from each organization, as Xavier said, from program data, from talking to people, and to use information about best practices to develop innovations to improve service delivery. Do you want to click on, Greg?
Sure.
You can do it. Okay. So what we're presenting here today is based on the hard work of many of our partners. The actual model was designed as a hub and spoke model. There was a main hub, which you see at the center of the diagram, and that was intended to be the central gathering place for participating organizations to exchange new knowledge and evidence created by the different sub-hubs. As you can see, there were 4 sub-hubs, and each sub-hub explored a different issue. We had client engagement, then we had staff engagement, staff capacity, and our last hub, which we're just finishing off now, is employer engagement. Each hub consisted of approximately 8 participants from a range of employment service and service-related organizations. They met once a month for about 6 months to explore and problem-solve issues around each of the topics. Each sub-hub was facilitated by a subject matter expert who was able to draw on their own expertise and the best practice related to that particular domain. Next slide. So you will recognize this approach from earlier in the forum when Susanna was talking about the easiest approach. So BizHub brought together behavioral insights and design thinking and process improvement to help organizations improve their processes. The key to our approach was that we wanted any innovations to be based on evidence so that they consistently and that they should be consistently achieved and low cost, and also wanted them to be scalable, as Xavier said, so that if they were found to be useful, other organizations could use the lessons that we learned. So you've heard from our other panelists about how important it is to understand the issues before trying to solve the problem. One way of doing this is to map out the processes involved. And this is what we did within BizHub. When our sub-hubs first met, we spent some time mapping out various business processes and explored what was supposed to happen alongside what was actually happening in order to identify bottlenecks or areas of service delivery that could be improved. Throughout this process, we tried to place the user at the center of the process. We kept asking what would the user, and whether that was a client or a member of staff, be required to do? What decisions would they have to make? What information had they access to? And whenever we identified a number of bottlenecks, we reviewed them as a group and collectively decided which ones to move forward with. Once we had decided the issue to be tackled, we started our design, innovation, or our nudge. Many of you will have seen this diagram before. The mnemonic EAST reminds us that whatever we implement should be easy. It should reduce the hassle factor and simplify the process or the information. Our nudge should be attractive. It should attract attention, whether that's in terms of layout or in terms of incentives. And it should be social, by which we mean that it should show that most people perform the desired behavior. And it should be timely. So we need to prompt people when they're most likely to be receptive. So that's all I'm going to say. I'm going to hand it over to Greg. So hopefully you have a general sense of the BizHub project, and Greg will tell you about the hard work of each of our sub-hubs.
Thanks so much, Barbara. So you can see here and in the diagram of the model, the first sub-hub that was selected by the project advisory committee that was part of the project was the client engagement subhub. So this surfaced as the first process to address. And again, just to reemphasize that in choosing the 4 processes, we really listened to practitioners on the ground because they know best, what they are the areas that they wanted to make improvements. So in this first subhub, 8 practitioners from around BC came together to explore client engagement in both its initial stages and its sustainment. And for each of the 4 subhubs, in many ways similar to what we saw in the previous 2 presentations, we have a framework where we're going to describe, in this case, the bottleneck, the diagnosis, and then the ideas that the group members came up with to implement the improvements as they were. So in this case, we heard that clients were not attending follow-up appointments, and we also heard that they did not appear to be using or understanding all of the information provided or available to them. So often they were not following through on an employment plan, and sometimes staff were unsure about how to support client information needs. So what we did with the group was to map the client journey to identify the various attrition points, look at the administration data, and really try to understand where the drop-off points were. So in undertaking this exercise, through our discussions with the group, through group members going back to the organizations, having conversations with their own colleagues, and collecting some program data for us, we borrowed from the framework that has been popularized in MDRC's work with the Bias Project, the Simpler framework, to improve the client appointment reminders that were sent to clients to remind them of their upcoming appointments. So here we really focused on the P in that simpler mnemonic. And I think Xavier used an example in his presentation where they used it in Texas. Here we used it also in reminders to really personalize the way that the reminders were delivered. So in this case, we worked with the organizations to design the new messages, whether they were by email, by phone, by text, in whatever way the method of communication, the preferred method was for the clients. And we worked together as a group using some of the different examples that we saw from MDRC and others on how to make that message more personal. So that was the first nudge. And the second nudge I'm going to talk about after this next slide was the development and conducting a literacy review for these employment services centers. So upon redesigning the messages or making changes to the messages, these were the results that we saw. So you can see here that the attendance increased at a significant rate after the messages were changed. So the left bar, the darker green bar, represents before the message, the standard message that practitioners were using, and then the right bar represents the redesigned messages. So attendance increased at a significant rate. We also saw a significant decrease in the number of no-shows after the new messages were implemented. Some of the observations and comments from both clients and the folks that we're working with within the group were that the previous reminders contained less information. And so these new reminders allowed for more personalized messaging with both the sender and receiver's name, as well as more information about what actually would occur during the appointment, so that folks had a better sense of what would be happening in their appointment when they came back. Staff said that the increased attendance at workshops, so not just the one-on-one appointments, but the group workshops as well, could be attributed to the personalized contact. And just as it showed in the data, staff were observing fewer no-shows, and they also liked the new scripts. So it was something that they were happy to try out and to use, rather than feeling like there was something that was pushed upon them. They also mentioned that clients commented on the friendliness of the invitation. And I'm going to talk just briefly about the literacy review, which within the same subhub was what we call the second nudge that was implemented. So without going into too much detail, we worked with Dakota Literacy Solutions, which is a major literacy organization here in BC that has done this kind of thing before. So again, we went through that same process where folks identified the bottleneck, they diagnosed, and then they came up with the idea to implement this literacy review. We worked with Dakota to put together the 5-step process for doing the literacy review at each of these employment centers. And many of the centers in the group were able to participate and follow this process. So this was something that, again, we didn't reinvent the wheel. We borrowed from what had already been done. We learned from Dakota, and then we contextualized it to the group that we were working with in the employment services setting so that it worked for them. So in the interest of time, I'm not going to go into too much detail, but just to highlight some of the observations and comments that came out of this process, staff said that they were better able to understand the needs of clients and that they had greater awareness of literacy issues for low literacy clients. This was something that came through the presentation that Dakota did to kick off the half-day literacy review. Clients were better able to read posters, pamphlets, and other communications, complete forms, and understand written instructions. And they also said that the process was informative and useful. So they really raised awareness of literacy issues and comfort levels of clients. And it also increased the buy-in and compliance of clients and folks that were seeking services at each of the centers. So our second sub-hub was all about staff engagement. So in the second sub-hub, again, we invited practitioners from across BC that had a vested interest in this area. So a mix of HR folks in HR departments, program managers, and folks that really were looking at ways of improving the level of engagement of their staff at their organizations. And so just a quick quote on this topic of staff engagement. It's important for retention and recruitment, and it's because we know that engagement is a positive attitude held by the employee toward the organization and its values. An engaged employee is aware of business context and works with colleagues to improve performance within the job for the benefit of the organization. And it's something that the organization must work to nurture, maintain, and grow, and this requires a two-way relationship between the employer and the employee. So this is just to give you a little bit of a sense of why it mattered so much to the group. So again, going back to this 3-step process or framework, they noticed that there was low staff engagement, high staff turnover in some cases, and they stated that a lot of the challenges were due to internal communications. We were able to see this especially with a survey that looked at different areas of internal communications that was responded by over 200 people across the 8 organizations, and that really allowed us to pinpoint some of the specific issues around staff engagement, and particularly with regards to internal communications. So through the information from the survey, we, and really credit to the group members in this case for coming up with some of these ideas, and there were a number of them that you can see on the bottom of this slide to address the challenges that they were having with internal communications. So a lot of folks were saying that the emails were getting lost. So there were one organization redesigning the way that the email was laid out and categorizing it more intentionally. One organization implemented what they called a good morning email. So a way to share news and important information at the start of the day with all of the staff members. Another organization started a morning huddle. So again, similar idea where instead of sending it out by email, getting together in the morning as a team and talking about the issues of the day, what's on everyone's plate, and really setting a positive, upbeat start to the day. Another organization started doing staff newsletters. So taking some of the information that was getting lost in emails and putting them into a separate document that, if you see it come in, you could read at a later time when you had more time, and information wasn't as scattered. It was all centralized, especially around things related to social events, birthdays, that kind of thing that were more of a kind of on a social level. One organization added team meetings, so they saw that communication wasn't quite working as well as it could with the front desk group. So they decided to start weekly meetings with the folks working the front desk area. And then finally, another organization started a social message board, so that, again, some of the information that was maybe not the most appropriate for emails, according to some staff, could just go on a separate physically located social message board somewhere in the office. And just a quick note about some of, again, the observations and comments. So folks were saying that these innovations were able to address some of those specific internal communications concerns, and the group members said they were receiving positive response from their colleagues. They also noted that the innovations contributed to reductions in meeting length and frequency, and it reduced the volume of emails sent to staff, which was certainly one of the bigger issues around their communications. Number three, sub-hub number 3 was about strengthening staff capacity. And we had a group of practitioners, again, with a vested interest in this area, in training and development, education, and service providers as well. Working with them, noticed that the bottleneck was a lack of awareness about the career development profession. So people just not knowing what the profession was all about, perhaps hearing inconsistent information. And so we diagnosed that they wanted a tool to clearly communicate information about the profession, especially to new and potential talent. And so the idea that they came up with was to create an infographic for organizations to recruit and retain staff. So again, a tool to clearly communicate information about the profession, especially to new staff, that provides clear, concise, and useful information to really engage the conversation in the initial stages. And after initial design phase and many iterations, the group came up with what you see here on your screen, which is the CDP infographic with information that was decided by the group as the key information to really help people understand more about the profession and why they might be interested in being part of the field, becoming a CDP. So this information and all of our BizHub information is available on the BizHub page, which I'll send out in the follow-up email next week. But so you could download a copy of this. But you can see here that we included things like education, where they could take CDP courses and programs, some of the various roles, skills and competencies needed, some labor market information, and a testimony about why this person enjoyed her role so much. And then finally, the fourth sub-hub was on employer engagement. And as Barbara mentioned, we're just wrapping this one up. So here, folks in the group, again, from a variety of organizations, in this case, again, mostly service providers, were saying that employers are not aware of the supports from employment services organizations that were available to them. And they were saying that employers were not engaging with their organizations and not accessing information that could really be helpful and useful for them in receiving supports from these organizations. So the idea that came was really similar to the staff capacity sub-hub in that it was an infographic or a rack card as it developed that would be an initial engagement tool to engage employers in those early stages. So a way to summarize an organization's capacity to support the workforce development needs of employers in an attractive and digestible format. And here you can see a draft or nearly final version of what that rack card and infographic looks like. So the front page and the back page. And again, this is targeted to employers that likely have a low level of knowledge about the services of workforce development agencies. It's based on some of the research in this area, as well as what the group members identified as the most pressing information and key information to really catch the eye of employers that they were struggling in capturing their attention. So it's different from the previous infographic with the previous sub-hub in that this one can actually be customized to the organization in a number of different areas, but it also shares that common branding. And so we've got 8 organizations in the group all intending to use this in their marketing materials So common colors and images, but with information like, for example, on the bottom left there, you can see we helped local employers fill 150 jobs. That's going to be different for each workforce development agency. And of course, their contact information and other areas, so they can really tailor it to their own organization while being part of that common branding as a workforce development agency here in the province. So I'm just going to wrap things up by sharing some of the lessons that we've learned collectively from the BizHub project. Really, the BizHub has showed us ways of raising organizational and staff capacity to problem solve in a systematic way with a user-centric approach. So we certainly learned a lot from the other initiatives that were out there. Xavier and Gianna and Sin shared some perfect examples of areas where we borrowed, but also I think one of the really interesting things about BizHub is that we brought folks together from different organizations to work on a common issue or a common problem, and that allowed for a lot of discussion and debate sometimes. But I have to take my hat off to those folks in each of the subhubs for working together across organizational lines to try to make improvements within their own organizations. So it encouraged them to view challenges and solutions collectively and holistically. Organizations really were on board with the idea of using organizational data to identify the bottlenecks. So they were going back to program data, to conversations with their colleagues, and really using the information to help identify the bottlenecks as best as possible. Certainly, like I mentioned, looking at best practices that are out there and adapting in lessons and implementing them within your own context. And I think one thing that we would say to anyone thinking about trying any of the approaches mentioned today is don't be afraid to think outside the box. Get creative and think about ways of doing things differently, even if it's a small thing. It really could make a big difference. And so finally, I just want to do a plug for our next online forum, which is going to be for the BizHub project. I've kind of sped through what we've done within those 4 subhubs in a short amount of time. And here, we're going to have an opportunity to go in more detail. And we're still fleshing out the details of what it's going to look like, but we've tentatively set a date for January 24th next year. And I'm sure it'll be here before we know it. So please stay tuned for, if you're interested in learning more, you'll be able to sign up for this forum on the 24th of January. Okay, so that brings us to the end of the BizHub presentation. And I'm just going to switch slides and we're going to return to the easiest project. And once again, I'm going to pass it over to my colleague Barbara here, and she's going to tell us more about easiest and what we've heard so far from some of the work that we've done.
Oops.
Oh, here we go. Okay, over to you, Barbara.
Let me do this in control. Okay, so back to talking about easiest. Susanna introduced the project at the beginning of this webinar and told you about our overall goal, which is to make it easier for newcomers to access the right services at the right time. And the easiest project will incorporate the approaches you've heard about this morning to help bring about improvements in service delivery and access for newcomers. And as I've already mentioned, we hope easiest like BizHub will make it easier for newcomers to access the services they need, but we hope also that organizations and their staff will also benefit. We've seen from BizHub and from what you've heard from our other speakers that improvements in service delivery will make systems more effective and efficient and can be part of the continuous improvement cycle. And like Greg has suggested, the feedback from the staff that we've worked with so far has been very positive, as the small changes that were made in their interactions with clients made their work more rewarding. So Our approach, you'll have seen this, a version of this diagram all morning, will have 4 stages. Stage 1 will be discovery. We will talk to newcomers and service providers to identify potential opportunities and areas that could be improved that would make access easier. Stage 2 will be the diagnosis stage, and will consist of working with a group of immigrant serving organizations to examine where the bottlenecks are. And we'll work with them to use their program and administrative data to get a good understanding of where the challenges are. Stage 3 will be the design stage, and we'll bring together best practice evidence with expertise of our group of service providers, and we'll work collaboratively to design innovations to address and remove the bottlenecks. We will encourage service providers to adopt a human-centered approach, and with the goal of always that the innovations will be low cost and straightforward to implement. The final stage, stage 4, is the delivery. We'll work with service providers to implement and to test the innovations within their own organizations. Our past experience suggests that there will need to be some customization to tailor things to the different organizational settings, but we are confident we'll get there. Our role will also include evaluating the innovation to find out if it works and to explore the benefits to the organization and newcomers. How we will do this will depend on what we'll end up implementing. So our project plan for Easiest is to start with a targeted literature review, which will explore some of the challenges newcomers experience when accessing services. We've been working on this, and I will talk about some of our initial findings in a moment. The second component will be to conduct focus groups with newcomers. We've done this, and we've conducted 4 focus groups in Vancouver and Surrey with newcomers to Canada, and I'll give you some of our initial findings in a few moments. The third component is to talk with organizations who are delivering services to newcomers and who have direct knowledge of the challenges and opportunities that they experience. We've just started these interviews, so this really is a work in progress. Our final task, whenever we've finished the above, will be to convene our hubs. Our goal is to have 2 hubs. The first will bring together immigrant service organizations, and the second one will have a wider scope and bring together multi-service organizations who work with newcomers as part of their mandate. Okay, so on to some of our initial findings. To many of you familiar with the literature of newcomers and service use, this will probably not be a surprise, but it's useful to remind ourselves of the context in which we're working. First, the immigrant population across Canada and in BC is growing. It's a very diverse group ranging from refugees to economic migrants. Some immigrants are highly qualified with good language skills, and others are not. The result is that service organizations are dealing with a client population that has very diverse needs, and this presents some unique challenges when trying to deliver services. It's also important to realize that 39% of newcomers used IRCC services, which means that about 61% did not. The question is, why not? Did they not know about the services? Did they choose not to use them? Were they unaware, or did they simply not need them? Okay. A challenge for newcomers and service providers is that services tend to be fragmented. Newcomers access services but often have to be referred on for specific support, such as employment supports. Services also tend to focus on issues rather than adopt a more holistic approach or a person-centered approach. Now, there are very good reasons for this, including the funding model and the kind of resources available. But it's a challenge. A considerable amount of literature also highlights the lack of Canadian experience and recognition of credentials as a barrier to accessing employment, especially within a newcomer's professional domain. So there's nothing too new or surprising here. Next slide, Greg. When we think about our focus groups, this is a summary of what we've heard. First, we saw and heard that newcomers were not a homogeneous group. They had very diverse needs, they had very diverse skills, and they had differing access to resources. They came from a variety of countries, but they chose to come to Canada. Some newcomers were highly skilled professionals who hoped to find work within their domain. Many of these individuals had researched living in Canada before they arrived. They had good language skills, and they mostly came with some savings to help them transition to life here. Other newcomers came as sponsored family members or as refugees. These newcomers were very different. They had a mix of skills and different levels of language proficiency. Their service needs tended to be more comprehensive. The participants in our focus group also had very different expectations and perceptions of success. For example, economic migrants saw success as being able to find work within their profession and in beginning to acquire a similar standard of living to the one they'd left behind. It was this group of newcomers who were most frustrated by the employment barriers they encountered. These newcomers had met the points requirements to come to Canada. They were accepted because of their expertise, but despite this, they struggled to find work because of a lack of Canadian work experience and challenges with foreign credential recognition. Refugees were pleased to be in Canada, which they saw as a safe place to live for themselves and their families. They were emotionally very tired, and they wanted to find somewhere to live and to find some work. Most of their savings had been spent while they waited to come to Canada, so they arrived with very little. And some refugees came under a sponsorship program, and in these cases, the sponsors proved invaluable. They took newcomers to the different services, helped them register at school, to find accommodation, and to get a care card, just to name a few of the things. We'll move on, Greg. A very clear message from newcomers were that the overwhelming majority of services were very welcoming and very respectful. However, newcomers differed in terms of how useful they found services. Sometimes this was because actually they weren't eligible for some of the services, or there was a waiting period, or that the type of help they required was not available. Some participants felt the services were not necessarily what they needed, rather than what was available. So there's a bit of a gap. Newcomers were also frustrated that the information and advice provided was not also always consistent between organizations. And the example that was given in our focus groups related to resumes. Each time a newcomer met with a new case manager or went to a different organization, they were asked to make changes to the resume. And sometimes the suggestion contradicted previous advice. And newcomers find this very frustrating and undermined their confidence. When we asked newcomers what would help, two themes emerged. They wanted more peer support. They wanted to connect with other newcomers and to learn from their experience. And we saw this, that after our focus groups, participants stayed behind to chat with each other and to exchange contact details. Newcomers also wanted more connections to employers from service providers. They wanted to be able to talk, they wanted service agencies to broker a direct conversation to employers so that they would know what they needed to do in order to find work. So what we're doing now and our next steps are to complete our stakeholder interviews, and they're ongoing and will be done soon. And then we're going to convene hubs of immigrant services and multi-service organizations, and that will hopefully happen very soon. So that's all I'm going to say about the Easiest project. We're very excited to be working on it, and it should produce some very interesting findings.
Thanks so much, Barbara. So Haley and I are continuing to monitor the questions coming in. We've had a couple come in. I think one question that would be fitting for this very slide that's up right now is we've got a question about the service providers that are going to be involved in Easiest. And so in terms of we've got two, we're planning on convening two hubs, with the first hub being immigrants, those specializing in immigrant services or immigrant services organizations. And that group's been selected, and they're ready to get going in January is the planned kickoff. And then for the second hub, it's multi-service organizations with an element or a focus where they are also delivering services to newcomers. I think for us, the message is, if you are interested in getting involved, we want to hear from you, especially when it comes to possibly being a participant in that second hub, which wouldn't take place until later on in 2019.
And if they're interested in the first hub, they can always just, we can, if they're not able to participate, we can always make sure we share the information. So there will be ways for people to participate.
So hopefully that answers the question there. And then once we do start the work, it will be made available, the folks in the organizations that are a part of the hubs. The next question, and actually was the first question that came up since we did the BizHub presentation. Someone had a question for Xavier. So I'm going to ask Xavier to unmute and take this next question.
So I guess in the last 15 minutes, we're now entering into the Q&A session.
Yes, thank you. That's right. So we still have about 15 minutes. We're right on time. And that's a good reminder to ask you folks out there to continue to send me your questions. We've had a few come in, but there's still lots of time. So please don't be shy. So Xavier, I'm not sure if you're there, but the question is about the design process that you use at MDRC.
Sure, yeah, I'm here.
Oh, great. And if it includes any ethical considerations. I'm thinking it might be a reference to the randomized control trials, but this person is using examples like psychological research or deception. Can you tell us anything about ethical considerations in the design process?
Oh, that's a great question. So I think there's definitely always an ethical consideration for any of the research that we do, and I know generally for this type of research, it has to go through an IRB. So there's always an ethical consideration that is applied to the entire research effort. But as far as for design, I think something that we learn in behavioral science is that, for instance, let's say you're choosing what information to present first. There always has to be something that comes first, and it's just a matter of making that decision. So I think as long as you're not being coercive or you're not being especially manipulative, I think it's a matter of just like making that decision and doing it to the best of your ability with the interest of the participants who are involved in any program or receiving any service. So I think that's a great question, but and it's definitely something that we consider, but I think all of our research gets reviewed, and I believe that, we've never had any questionable ethical situations with our design process. I think that's something that others could speak to as well.
And I would add for BizHub, we did have random control trials. And again, this is something that's really important at SRDC. And for EASIAS, we are trying to focus very much on RCTs. For the organizations that are involved, we know there's a bit of a cost for staff time. So we have some support financially to actually look at that, but usually it's very low cost, as you see. And we will, again, make sure ethically it all flows well and that it's more beneficial, there's no harm, and all the requirements are addressed.
Okay, thanks, Xavier and Susanna. Hopefully that answers your question. The next question is about some of the numbers in terms of the EASIAS project and the stakeholder interviews and the focus groups. So for the focus groups, we've completed the 4 focus groups, and there was about 30 participants across the 4 focus groups.
Yeah, maybe some more, but yeah.
Approximately
30, 35.
Yeah. And then we've done a couple of the stakeholder interviews, and these are with agencies that are not considered under kind of the umbrella of ISOs, but certainly provide services to newcomers. And the plan is to do 4 to 6 interviews total. And as Barbara mentioned, those are ongoing, and those will be completed pretty soon. Another question is about just sharing some of the information that has been provided today. So in terms of the EASIAS project, you'll be able to see some detailed information on that information flyer that was part of the registration link. Of course, we'll be sending out the slides from today. And then really, I would just encourage you to get in touch with us if there's anything more you want to know or you want to share with service providers that you might think be interested in knowing about this initiative. And certainly the link will be shareable as well. So you'll be able to forward the link to the recording to anyone you like. and we'll be posting it on YouTube as well. Another question coming in about, does anyone have any thoughts on how we can make it easier for government personnel inexperienced in service design or BI, behavioral insights, to engage in these types of evaluation activities? Susanna?
Well, I was thinking that maybe we'll throw the question over to Deanna.
Oh, yes, good call. Okay, Gianna and Sin, are you unmuted and are you able to take that one?
Sure. Can you just reread the question, please?
Yeah, absolutely.
Yeah.
I'll also see if I can forward it to you so you can see it, but I'll also read it out. So the question is, are there any thoughts on how we can make it easier for government personnel inexperienced in service design or behavioral insights to engage in these types of evaluation activities?
That's a great question. Yeah. Do you want to start, Sin?
For someone probably who's not experienced in this kind of work, I think there are lots of valuable resources. Like, of course, there's Government of BC, but there's Government of Ontario, there's the federal government who've done a lot of, have put up a lot of resources, and that could be a good starting point just to understand the domain. And maybe just starting small with projects many times is a good start. I mean, low risk, something that you can try, and even if you, I wouldn't say fail, but even if the process doesn't go as you imagine, just iterating on it, taking your learnings further, and then redeveloping it so that it's a process that's foolproof as you go ahead.
And I'd just like to add around service design, around service design methods and approaches. That a lot of those approaches are very easy to start to implement. So if you're looking at even doing, even before you've gone out and done research, which seems to be the more difficult thing, especially even in the BC Public Service, for public servants to really understand how to go out and talk to people. But there's work that the team can do together around, you know, looking at your user groups, developing some proto-personas, even doing mapping a journey experience from your perspective, and then going and starting to talk to people to really, you know, validate those assumptions that we might have is a really easy way to get started as well.
I just want to add, I think what Deanna and Sin are already doing, being in public area and engaging with government people and introducing this and, you know, testing this out with different areas and having some winners and learners. I mean, that's the perfect way to start engaging and actually raising awareness. And I think that's very similar to what we're doing, but in the kind of the employment service and the settlement area. So just going out there, engaging, and showing what we can do and being helpful. I think that's really important for anyone in public or nonprofit or even private who's not aware of these techniques.
Great, thank you all. Move on to the next question here, a really great question about engaging rural communities. The question is, how do we engage with more rural communities providing services to newcomers? Their needs and barriers might be more complex due to limited resources. Just wanting to ensure the voice of smaller communities is heard in this project.
That's a great question, and I don't want to segue into another project we are doing, but we are doing some research supporting the IRCC's Visible Minority Newcomer Women Initiative announced in the budget 2018. That is something we are paying attention to for that population. Yes, the concentration is mostly in the metro, the large centers, as well as some of the larger centers in the prairie provinces. But as a research and a project team, we are paying attention to visible minority newcomer women in the rural areas, and we're looking at different interventions to support that group. And I think that's a really good question for overall for newcomers as well.
Thanks for that question.
And I want to add also in BizHub, it was for organizations across BC. So we had, numbers in the Metro Vancouver area, but we also had service providers who were in some of the other areas, including more remote areas too. So that is also our aim for Easiest, for the first hub and the second hub, that we're not overly concentrated in Metro Vancouver, but we're spread out in the other area, and we are targeting organizations that are representing participants or their clients who are more remote.
Great, thank you. Next question is about how the government of BC, so this would be directed towards Sim and Deanna, how do you select which projects the GDX team or department works on?
That's a great question. We have, when we talk about alignment, so in our presentation we talked about alignment, really what happens is a ministry or a program area will come to us and say, I have a problem. And we spend a lot of time really understanding what that problem looks like, what it's about, and if it's the right problem, to tackle. And at that point, it could be something that our team could definitely tackle, or a lot of times areas will come to us and say, well, we just want to build a website, or we already know we're going to develop an app, or we already know we need to do this other thing. And at that point, in our process, we look at the whole service experience. So, if people have already decided on what the outcome is going to be, we're kind of like, well, maybe you don't need us. Maybe you need to be going and talking to a developer, ensuring that you are including sort of user experience and a bit of a design component, but it wouldn't necessarily be work that we would do. So we look at it from that lens. We also look at it from a lens around, we're in government, we have a lot of political agendas, and sometimes things come our way politically that we need to be, using a more human-centered approach around. And so that is something that might come in through sort of our senior executive, where they're like, we need to do this. And then another way that work might come to us is through, or how we would select is, really what the problem is, if it's, juicy enough and big enough and, a way that we can really dig into it and really understand that whole experience. And then it also hits some buckets around our vision in, ensuring that we're developing, more personalized digital services and services in general for people. We'll put that lens on it as well. So there is a variety of ways. We don't have a formal process. And it's more just conversations and really understanding if it's the right work that we as a team should be doing, or if the ministry team is maybe already set up and just needs some guidance in how to actually go forward with this work on their own.
Yeah, added to what Deanna has mentioned, another way could have been like just to see the organizational readiness, as Deanna mentioned, where government, so sometimes even looking at it from top down, is there executive buy-in for that? Is another way that you can see, and how we probably get projects within our team.
Thank you, Sim and Deanna, and thanks for the question. Just keeping in mind the time, I think we're at our last question here, and I hope you don't mind, Xavier. I'm putting you on the spot. I forwarded the question to you, and the question is, what are the biggest challenges you faced in improving public services with these approaches? And I think, the reason for getting your perspective on this is, of course, with the BIAS project, it spanned a number of years, 15 trials across a number of states all over the US. So I'm sure you've seen it all, and your team has seen it all. So anything that you have to share around some of these biggest challenges?
Yeah, I mean, that's a great question. For me, it kind of has an obvious answer, although still complicated. I think it's just kind of the bureaucracy. Honestly, we work with a lot of federal programs and state and local agencies, and there are kind of oftentimes maybe more substantial changes that we want to make that we're just not able to do because we have limited flexibility. And, you know, I think it's interesting because actually at MDRC we started a new project, which is kind of like the extension of the BIAS project called BIAS Next Generation. And for that project, we're trying to do a little more, like I talked about for BIAS, we were trying to motivate people to attend appointments and just increase engagement and participation and things like that. For BIAS Next Generation, some of the interventions we're doing are a little bit heavier touch type interventions, and it's pretty difficult to work within a lot of the systems. Yeah, I'm not sure if it's different in for the Canadian government, but for the U.S. government, there's quite a bit of bureaucracy and kind of just barriers that that we wish we could get around, but our hands are tied oftentimes, unfortunately. So I would say like that is clear and above the biggest challenge that we've faced.
Great, thanks, Xavier. Thanks for the question. So, well, it's hard to believe our 2 hours together have come to an end, but on behalf of Susanna, Barbara, Haley, and myself, I really want to thank Xavier, Deanna, and Sin for your enthusiastic and informative presentations today. You gave us a lot to think about when it comes to the way we design programs and services. And we also want to say a big thank you to all of you out there for attending, participating, and contributing. A reminder that today's forum was recorded and you will receive an email next week with the link to view it. We will also be sharing the slide decks in that email. So before we say goodbye, we would like your help with one final item. When you exit the forum, you will be asked to complete a short survey. We would appreciate it if you took a minute or two to share your thoughts. They will be a big help to us as we move forward with the Easiest project. So that officially ends our forum. On behalf of my colleagues here at SRDC, thank you for joining us and have a great afternoon.